Hello, I'm Sheryl McCarthy of the City University of New York. Welcome to One to One. Throughout the presidential campaign, Donald Trump promised that if elected, he would do whatever he could to end legalized abortion, including appointing pro-life judges and ending federal funding for Planned Parenthood. So far, President Trump's efforts have been met with mixed results. But perhaps encouraged by his pronouncements, a number of states have passed laws banning certain abortion procedures and creating new requirements aimed at limiting women's access. Some have been upheld by the courts, others have not. So where do we stand on reproductive rights right now? Have the threats to reproductive freedom been overstated, or are they very real and troubling? For almost 50 years, the Guttmacher Institute has been bringing us the facts about the impact of policies concerning sexual mores and reproductive rights through its research and advocacy. And today, Ann Starrs, President and CEO of the Institute, will bring us up to date on what the current issues are. Welcome.
Thank you.
According to a lot of people in the pro-life movement, women's reproductive rights, which have been under attack for decades, are in crisis. They would say that they are in crisis under the Trump administration. Do you agree?
I would agree with that statement. You're right in your introductory comments that the Trump administration has had mixed achievements from their perspective in terms of their attack on reproductive rights and specifically abortion rights. But that's not for lack of trying. We know that the attempt to repeal and replace the Affordable Care Act would have done significant damage to women's access to reproductive health services, both family planning as well as abortion in this country. They have not achieved what they were trying to do, but that's not for lack of trying, and I think the most important thing is that they're going to keep trying.
Now, the president threatened, made gestures that he was going to eliminate funding for Planned Parenthood. But then he seemed to back off on that. So where does that stand right now?
You're correct, and that threat has not been executed on quite yet. The Congress just passed a budget agreement that will be in place for the rest of this fiscal year, and that does not include defunding for Planned Parenthood. So that's an achievement.
What do you think happened?
I think most likely that they knew that the chances that there would be a big fight in Congress and that there would be a strong reaction from the public. There's strong support for Planned Parenthood. Millions of women get services from Planned Parenthood, and millions more have in the past. And there is strong support for and a strong recognition of the importance of Planned Parenthood as a provider of a range of reproductive health services. So I think it was a political calculation.
And as you pointed out, the Trump administration's efforts to appeal the Affordable Care Act, if they had been successful, would have affected had a negative impact on women's reproductive rights. How so? Now, they weren't able to accomplish that, at least for now, but what would have been the impact if they had?
Well, the impact would have been first and foremost by eliminating health insurance coverage for millions of people, including, of course, millions of women. It would also have most likely, and there's still a good chance that they will try and do this, restricted or modified, or perhaps it's unlikely completely eliminated, Medicaid. Medicaid is a hugely important source of coverage for family planning services for women in this country. And if Medicaid were constrained, which is something that the states still may be able to do, then there will be dire consequences for women's access.
Were they trying to get rid of Medicaid altogether?
I don't think they were. No, they weren't trying to get rid of it altogether, although there are probably some in Congress and perhaps some in the administration who may have that as an ultimate goal. But no, that was not an explicit part of the aim.
There has been something going on at least certainly for the last few years. States trying to adopting abortion bans during the second trimester. Have those actually gone into effect, or were they stopped by the courts?
There are a number of states that have banned abortion after 20 weeks. There are other efforts to restrict abortion by restricting, in particular, dilation and evacuation, which is the most common and safest method of second trimester abortion. There are also efforts to ban abortion for sex selection, for fetal anomaly, and for race, which I think is an odd thing to do, but there are a number of states that have passed laws that would attempt
That are
to
in
restrict.
effect.
Not all of those are in effect. Some of them have been challenged in court, but a number of them, in particular, the banning of dilation and evacuation, some of those are in effect. Yes.
Okay. Now, Roe v. Wade basically allows abortions for all women in the first trimester and says that after that, states are free to place sort of like reasonable restrictions on abortion. That's basically what Roe v. Wade does at this point. Okay. In what states or regions are women's reproductive choices most limited? Is it a Southern thing? Is it a Midwestern thing?
It's primarily a Southern thing and a Midwestern thing. If we look, the Guttmacher Institute has a classification method of looking at how many restrictions there are on abortion per state and by legislation and regulations. And we classify states according to highly restrictive, somewhat restrictive, et cetera. 57% of women in the United States live in states that are highly restrictive or restrictive in terms of access to abortion, and the majority of those states are in the South and in the Midwest. I think the only Southern state that is not classified as highly restrictive or restrictive is Maryland.
So how would you describe the status, if you had to describe the status of reproductive health services in the U.S. at this moment in time? Do all women have access to contraception, basically, if they want it, need it?
Well, certainly legally, all women have access to contraception. The key issue and the key obstacle for many women has been the cost. And this is why the Affordable Care Act was such a huge benefit for women in this country.
How much does a monthly supply of birth control pills cost these days?
I'm not sure, but
the price has gone up, I guess.
The price has gone up, and if you look at, for example, an IUD, which is a very effective method of contraception, the cost of an IUD is just under what a woman would earn in a month if she's earning minimum wage.
Wow.
So that's pretty expensive.
Do all women have access to medical care during pregnancy and care for their babies afterwards? I mean, through Medicaid or other programs?
Yes, Medicaid covers millions of women on an ongoing basis for all their health needs if they are eligible. But even women who may not be eligible for Medicaid are covered by Medicaid on a sort of emergency basis for labor and delivery specifically.
Okay.
And it's interesting, of course, the women who are most often excluded from Medicaid are women who are undocumented, or even once women have established residency, if they're immigrants, for 5 years, they're still not eligible for Medicaid.
Really? So if I'm an undocumented woman and I'm pregnant and I go into labor, can I go to the local public hospital and have my baby and have those costs taken care of?
Yes.
Okay. How about access to abortions? Do all women have access to abortions if they want them?
Well, that depends on how you define access. I don't want to mince words, but again, there are no legal restrictions that completely ban access to abortion for most women, but there are enormous numbers of restrictions and challenges that make it difficult for women to access.
Like whether there's an abortion provider within 100 miles.
Correct. So the first and probably biggest challenge for women in large parts of this country is geographic access. Is there an abortion provider within a reasonable distance? Then there's also the cost issue, because laws in this country, the Hyde Amendment in particular, ban government funding, federal funding, for being used to cover abortion except in cases of rape, incest, and endangerment to the woman's life. So if women don't have private insurance to cover the cost of abortion, then they have to get those costs covered themselves. They have to figure out a way to cover that cost of abortion. And then there's also just the logistical restrictions. Because of some of these regulations and laws that states have passed requiring, for example, that women get counseling and then wait 1 or 2 days before actually getting the procedure, things like that.
But they've already had to travel 100 miles and they have to stay in a hotel and it's extra expenses.
They have to get time off from work,
right,
etc. Yes, the logistical challenges of getting abortion are definitely increasing in this country.
Is the use of contraceptives in this country rising, falling? My sense is that it has risen.
There hasn't, overall, the rate of contraceptive use hasn't increased dramatically, but what we've seen is a shift to more effective methods. So methods like IUDs and implants are being used more often now by women of reproductive age, including younger women, even adolescents. And the American Pediatrics Association has in fact recommended now that IUDs can be used by adolescent women. So that has shifted the proportion of women who are using these more effective methods. And so what we've seen is significant declines in the rates of unintended pregnancy in this country. And that the result of that has been the lowest abortion rate. The abortion rate right now in the United States is lower than it's ever been.
Really? Okay. So is the pill still the most popular method, or what are the most popular methods?
Oral contraceptives are still the most popular method. IUDs are coming up. Condoms are still used a lot. There's 18 methods that are approved by the federal, the Food and Drug Administration.
Are there any promising new methods that I haven't heard about?
There is research underway. It's true. We haven't had any real breakthroughs in terms of new methods for some time. I mean, the implant was, but that was quite a while ago, was a new method. Some of the interesting research, and I confess I don't know the details of it, is being done on male methods, which is always an interesting topic of conversation.
Right now, I read that there are 2 methods for males now. There's condom. I don't know what the other one is.
Well, there's sterilization.
Well, that's true. Okay.
Yes, vasectomy.
Okay.
Yes.
Some years back, I remember there was an announcement of a new product, and it was called Seasonal at the time. And this was basically, it was a birth control pill, but it meant that you would have only 4 periods a year instead of 1 every month, and that it had been found that there was no medical danger in that, and that sounded really exciting. That sounded really exciting, you know, that women could be free from the monthly, you know, distress. And I don't know, I haven't heard anything more about that. I hope it's still on the market. So, and you said unwanted pregnancies are down, and the number of abortions are also down. How about the day after pill? Are people using that a lot, or?
Yes, the technical name is emergency contraception. Plan B is what it's often known by colloquially. Right. Yes, the morning after pill. And that is a very quite effective method, depending, of course, the sooner it's used after unprotected intercourse, the more effective it is.
Is that available over the counter, or do you have to have a prescription?
You can now get it over the counter. That was a legal fight. And that actually, interestingly, the Obama administration the FDA under the Obama administration actually resisted making the emergency contraception available over the counter, but that was finally approved. And also to make it accessible to adolescents as well, right? Because it's a, as you can understand, it's an important method for adolescents in particular.
We're going to take a short break, then we'll be back with more with Ann Starrs, President and CEO of the Guttmacher Institute, right after this message. Welcome back to One to One. I'm Sheryl McCarthy of the City University of New York, and I'm talking with Ann Starrs, President and CEO of the Guttmacher Institute. How would you describe the state of sex education in the schools these days?
In the United States?
Yes.
Highly variable. This is one of those issues where states and even local school boards can decide for themselves what to cover or what not to cover. And so the situation is dramatically different, depending, of course, on the political orientation and the religious beliefs and so forth of state legislatures and local school boards. So what we're seeing is, in some cases, support for abstinence-only education, and that's something that we expect to increase under the Trump administration and the new Congress, in particular through federal funding for abstinence-only education. And we see reluctance and sometimes actual avoidance to provide really comprehensive sexuality education, which includes education on, of course, reproduction, how pregnancy happens, et cetera, but also should, of course, include information on different methods of contraception, how they work, how to access them, as well as things like HIV, sexually transmitted infections, et cetera.
Are there any particular programs or states that are doing a good job that you know of?
In general, and you see this in terms of the profile of how states are dealing with reproductive health and reproductive rights issues more broadly, we see better programs on the West Coast and on the East Coast, and a few states in between, but again, it's highly variable.
Mm-hmm. Mm-hmm. You mentioned that you expect the Trump administration's existence to have some impact on bringing more abstinence-only programs into being. Any other ways that the administration that you feel it's already had an impact on the state of reproductive health services in the country?
We haven't seen that much impact yet, but it has only been 100 days. And so there is still time for a number of things to happen, both legislatively, but one of the other things that we're seeing is the appointment of individuals who have a strong track record of being hostile to reproductive rights. Tom Price, of course, fits that bill. Mike Pence is well known and did a number of things as governor of Indiana to restrict access, in particular to abortion rights, but to other elements of reproductive health care as well. And just this week, there have been 2 new appointments to the Department of Health and Human Services, one of whom has worked for the National Right to Life Committee and the Family Research Council, which are well-known and very active anti-choice groups. And then there's another person who's just been appointed who was the former president of Americans United for Life. Now, one of these women is going to be in charge of the Title X federally funded family planning program, and she has basically stated that she thinks that family planning should be an issue between a husband and a wife and God, but that there's no role for the federal government.
What role does the government play now?
Federal funding is hugely important in providing access to family planning services, in particular for low-income women. Medicaid, for example, accounts for 75% of public spending for family planning, as does, and Title X is also an important element in that as well. That funding goes, in some cases, to Planned Parenthood, but goes to other local health clinics as well, and women are able to access, in particular low-income women, are able to access contraceptive services. So our statistics show that if these programs weren't in place, that rates of unintended pregnancy, for example, would increase dramatically by 50-60%.
Do you have any problems with or concerns about the president's recent appointment to the Supreme Court?
Neil Gorsuch, yes, that's an interesting question. He carefully avoided any specific comments about his position on abortion rights during the confirmation hearings. So we only have a couple of things to go on. One is that he actually decided or opined on one of the important cases that looked at the issue of, in particular, religious rights and companies or organizations that object to certain methods of contraception, the Hobby Lobby case, you may recall that. And he was supportive of allowing employers and companies to prohibit women employees to have their health insurance plans not include coverage for contraception. Mm-hmm. So that's not a great signal in terms of his clear support for for objecting to reproductive health services on a religious basis.
The Guttmacher Institute is famous for its research on sexual behavior and reproductive health issues. I remember a report that you did some years ago showing that despite this emphasis on not, refraining from sex until, telling young people refrain from sex until they're married, that I think it was 95% of Americans, and this was a study going back to 1934, have had sex before they got married.
Correct.
Very interesting.
and that's still the case
And that's
today,
still the case.
which is one of the key reasons that sexuality education, comprehensive sexuality education, and access to contraceptive services are so important, and federal and government funding for those services are so important.
Any interesting research that you've done lately that you want to mention?
Well, let's see. We've just completed a really interesting study that we call the clinic census, which is looking at, we do a census of all family planning providers in the country and have done an analysis of how many women they serve, what kinds of services they provide, et cetera, et cetera. And one of the interesting things about this study is that Planned Parenthood, maybe not a big surprise, while it doesn't count for a huge number of the clinics, accounts for a very important portion of the services because it's a very good provider. We also, earlier this year, did a study that looked at the quality of family planning and reproductive health services provided by Planned Parenthood in comparison to other clinics. And again, this is the provision of reproductive health services, of family planning services in particular, is Planned Parenthood's bread and butter. So it makes sense that they provide, in general, much better quality services. They provide the full range of methods. They have appointments available in the evenings and on the weekends. You can get an IUD inserted right the same day that you have your appointment. You can get your oral contraceptive prescription filled on the spot. In all these kinds of indicators, of measures, they do a much better job of providing services.
Does Guttmacher fund independent research, or is your research all your own research? How does that work?
It's a combination. We do a fair amount of research ourselves. The clinic census, for example, we conducted, and we do that kind of research ourselves. We also analyze existing databases from the government and from other sources.
Are there any particular areas that sort of cry out for research that you can think of that need looking into, we need data on?
Yeah, I think one of the gaps that we have is understanding more what's going on with young people, and particular adolescents. One of the interesting questions that I'd really like to know the answer to, and maybe not just because I'm a mother of an adolescent, is where do teenagers get their information on sexuality and reproductive health? We know that some of it comes to the schools, but we also know, this is the modern age, that they get a lot of their information from the internet. It would be really interesting and helpful to know what websites are they going to, how accurate is that information that they're getting. I think the other kinds of questions that we have relate to the impact of the restrictions that either have already been put in place or that are coming down the pike, and what impact is that going to have on women's rights, on women's ability to protect their health and to regulate their fertility.
You got about a minute left in which you can tell me what your priorities are for the Institute going forward.
Well, Guttmacher's mission is to protect and preserve women's access to sexual and reproductive health services and to protect women's reproductive rights. Our role is to do the research that provides the data, the evidence that can be used by the media, by advocacy groups, by policymakers who support these issues, to shape policies and to make the arguments for policies and programs that will enable women to achieve those rights. So we want to continue to do that research. We like talking to organizations that are, for example, providing services, to hear from them what kind of data and evidence would be helpful to them to design their programs, to design their policies. We are in touch with policymakers as well who are supportive of these issues. So we really want to serve the community within the context of what our mission is.
Have the issues changed? You've been at Guttmacher for 2.5 years. Have the issues changed at all in that time?
Absolutely. They changed dramatically after November 8th of 2016, and perhaps in particular after January of 2017. We had a whole work plan that was looking to what progress could we make in terms of advancing women's access, and our whole entire work plan has shifted to essentially a defensive one. How can we stop bad things from happening rather than how can we make good things happen? It's unfortunate, but that's what we'll do.
Okay. I'm afraid we're out of time. I want to thank Ann Starrs for joining me. If you'd like more information about the Guttmacher Institute, you'll find it on its website at guttmacher.org. For the City University of New York and 1 to 1, I'm Sheryl McCarthy. If there are any people you'd like to hear from or topics you'd like us to explore, please let us know. You can write to me at CUNY TV, 365 Fifth Avenue, New York, New York, 10016, or you can go to the website at cuny.tv and click on Contact Us. I look forward to hearing from you.